Unfortunately, there are an awful lot of germs in the human mouth can get transmitted to you if you're bitten. So, first thing, if you are bitten and it breaks the skin, allow the wound to bleed a bit to try and remove those germs, let them bleed out. But of course, if you're bleeding severely, then cover it to stop the bleeding. Then you want to clean it very, very thoroughly and cover it with a dry dressing. Most doctors would recommend that any human bite that breaks your skin does need checking out, but that's particularly the case if it's very deep, if it's on your hands, your face, your ears, or anywhere on a child's head, if you're not covered for tetanus, if you don't know who bit you, and therefore there's a chance that you might have been in contact with someone who has HIV or hepatitis, for instance, or for instance, if your immune system isn't working effectively. That's anyone who, for instance, has cancer, diabetes, is on chemotherapy, or has HIV. Now, later on, of course, it can also get infected and the skin can become red, hot, tender, and oozing. You may be feverish with it. If that's the case, go back to seek medical help, as you may need antibiotics.